The COVID-19 pandemic on the African continent. We're now joined by Dr. Edinam Agbenu, who's the Technical Officer for Quality and Safety for the WHO Africa region. Thank you very much indeed for joining us, and welcome to the program. All right, can you unmute your button there? Just check that it's unmuted. Can you hear me?
Yes.
We can hear you now. We can hear you now. Great. Thanks very much indeed for joining us. Welcome to the program.
Thank you.
All right. So what's your first thoughts on this C12 variant that was first discovered in South Africa in May?
In fact, there is a constant surveillance of variants, and there will always be variants, and that is why there is a strong lab network currently monitoring what are the variants that appear. And the most important thing to know is that not only that there has been mutations, but it is measuring the impact of any variant. Monitoring is in progress.
All right. So where else on the continent has it surfaced already?
Pardon me?
I said, do we know where else on the continent this C12 has surfaced?
This C12 has been discovered in South Africa and is being monitored across continents. So as more information is available, it will be presented to know where they are and what is their harm.
Mm-hmm. So is Delta still the prominent variant on the continent now?
So far, the concern about Delta is how much transmissible it is.
Right.
It is not the only, because the other COVID-19 strains that have been circulating are still circulating, but how more effective it is what has been the concern so far.
All right, so we're in the midst of a third wave, most countries across the continent. Is a fourth wave likely the rest of Africa? I know South Africa is already expecting one round about October, I'm told. Is that going to be the same across the continent, that a fourth wave is likely?
We are indeed seeing a real progress with 14 million of doses of COVID-19 vaccine being administered in Africa during the past week, which is triple what was seen in the previous week. However, we know that very few number of people are vaccinated, and the likelihood of a fourth wave is directly related to the proportion of people immunized at community level. We already have 3 countries with a fourth wave, Algeria, Kenya, and Tunisia. And at this point, we may not meet the 40% coverage target by December 2021. However, additional measures like the use of masks, washing of hands, avoiding crowds, together with battling to get the maximum vaccinated, will reduce transmission, thus giving the virus fewer chance to mutate and to give a fourth wave.
All right. Help us understand a little bit, because my understanding is that the vaccine does not prevent COVID-19, but rather minimizes your risk in terms of severe illness and hospitalization. If that's the case, does that not mean that transmissibility remains the same? It's just that fewer people will get sick? Or does it also help reduce the chances of transmission?
We have the vaccine as tool, among others, to fight against the pandemic. And the vaccine itself will prevent a lot of people from getting infected. However, we are using the tool with an objective, and our objective is that the number of people having severe disease or the number of people hospitalized or dying from the virus will reduce. And this is the objective with which we are using the vaccine. It does not mean that the vaccine does not prevent people from getting infected. It will prevent quite a number of people from getting infected. But we can ascertain the percentage of people that will be prevented from getting severe disease. And this is what we are targeting as a public health response system.
How is vaccination coming along across Africa? I believe that hesitancy has now started to subside and that more and more people are coming forward.
Our surveillance shows clearly that more vaccines have arrived in Africa, and there has been a mirrored increase in uptake. And hesitancy, this shows that hesitancy was just a matter of time. As vaccines are being made available, people are getting the vaccine across Africa.
All right. So have you been able to track in terms of, the increase in the number of deaths, hospitalizations as a result of the variant D?
The Delta variant has been infecting people more than the previous one. Even some already vaccinated have been infected. However, the increase in infection is more seen in people not vaccinated, and the severity and death are seen in people not vaccinated, even with the Delta variant. So the Delta variant, it's only that it has a shorter incubation time. So it means the time from infection to exhibiting symptoms. And this is driving a higher number of cases. But as I said before, it is higher in people non-vaccinated. That is the reason why we are making sure that vaccines are available for all those who are willing to take it. And we are making all effort also to bring balanced information so that people can take the right decision and get the vaccine as they are being made available.
All right. And there are no shortages now of vaccines. Are we happy with the level of doses that have become available?
The vaccines are becoming more available. Vaccination has resumed in many countries, and there are much more vaccines from sources. But WHO continues advocacy so that there will not be any interruption in the vaccination. And African countries are set even for more vaccine. If more vaccine, should more vaccines be made available, African countries are set and have the technicity of deploying them at a higher scale.
What about capacity? Are hospitals coping across the continent? I know that different countries have different level of resource, but generally, are we in a much better position than we were, say, a year ago?
The African countries have as their daily public health measures to battle against infectious diseases. And so as soon as this has started, African countries have first of all put in place what they are used to, for instance, to fight against measles, Ebola, cholera. There are some measures that are put in place, and also have learned lessons from those who received the first severity of the pandemic, and strengthened capacity of hospitals existing already, opened new facilities, and organized new care providing facilities to make sure that there are enough places to welcome all those who unfortunately would contract the disease.
So as more and more people get vaccinated, have you been able to track side effects? And if so, typically, what are we seeing? And have there been a concerning number of extreme cases, or has it all been quite within the range of expectability?
The WHO has been strengthening capacity of African countries for over 10 years now in vaccine safety surveillance. And now quite all countries have at least minimum capacities and are doing vaccine safety surveillance. And most of it, countries are putting in place reporting tools and making sure that there is an anticipation, because in vaccine safety, it is anticipation that is benefit, that is a great benefit. Without any doubt, we can say that the adverse event, no adverse event would be very harmful to someone if it were detected very early. The most complicated adverse event, the worst, would be the anaphylactic shock. And the vaccination deliveries are very well informed on how to monitor, to manage the anaphylactic shock. So any other adverse event, only if it is known and only if it is looked for, detected on time, there are resources, capacities to provide good care. And this is what African countries are working to have in place. And it has worked quite well in the first phase, and we are getting the more ready to welcome more vaccines.
So from the millions of people that have already been vaccinated, there's not been any indicator of concern in terms of side effects so far?
There have been side effects. Otherwise, it would have been saline water. It is not water. There is no drug without any side effect, but all have been so far under good control by the health systems of countries, and we trust that it will continue like that, and even it will improve the more, so that we can have a good anticipation, and all those who are vaccinated are kindly requested, should any adverse event occur, to report on time so as to be taken care of adequately.
What do we know about efficacy in terms of how long this vaccine is good for once you've been vaccinated, or are we still trying to work out the numbers?
The duration of protection with a vaccine depends on many factors, including the recipient, the virus, and the composition of the vaccine. We initially assumed, for instance, that protection with yellow fever vaccine would last 10 years. With more evidence, it has been extended to 35 years, and then now to the lifetime. As for other diseases, WHO is constantly monitoring the new evidences on the issue of COVID-19 vaccine. Protection may decline over time. So far, we have not seen a decline in relation to the most important objective of COVID-19 vaccines, which is prevention of severe disease, hospitalization, and death. And it is too early to say if those who have been vaccinated are likely to lose protection after so and so number of weeks or months or years.
So we're seeing a number of developed nations talking about a booster shot in the near future. Does this suggest that this vaccine might be like the flu vaccine, where maybe each year we have to go back and get another shot just to account for new variants that might arise?
Time will let us know where we stand as per this vaccine, because we have COVID-19 started in December 2019. Vaccination started a year after. And we are following up, making sure, putting all all it takes to get the people protected the most. So we are not giving any chance to the virus. There is no evidence that the immune system is getting weak as per day, like other flu viruses, vaccines, but we are not giving any chance to the virus. As much as we know, we implement to make sure that we do not lose life continually.
All right. Your job is to look at quality and safety. Are you happy and satisfied that all our vaccines are safe? Because we've only just seen Pfizer get full approval from the FDA in America, which suggests that most of these other drugs are still on an emergency basis.
The development of a drug goes through some phases that have been informed by happenings in the past, in the history of drugs. So we will never go back to using drugs without testing them. However, we have a condition that is killing people. So the question was to know if using the vaccine would save lives or not. It is the reason why the emergency use listing has taken place. And so far, so good. There have been adverse events. We cannot deny that there have been adverse events. But even with paracetamol, you have adverse events. Paracetamol is the drug that causes the highest number of liver cancer in the world, but we are consuming it every day. Here we have some vaccines that have been listed for this emergency to save lives, and it is saving lives. Less people are dying from COVID-19, and this is the objective. And we, as the clinical trials are continuing, should any signal arise, if the need be, a vaccine can be withdrawn simply because it is less safe for people. But so far, it is saving life and outweighs the risk.
And that is the good news. Dr. Agbenu, thank you very much indeed for joining us. And, your help is greatly appreciated. Merci beaucoup. Au revoir.
Je vous en prie. Au revoir.
Okay, that's Dr. Agbenu, who's the Quality and Safety Technical Officer for the WHO here in Africa. And so the vaccine's still a good news story. And again, testimony to the fact that those that are vaccinated are less likely to get severely ill and to be hospitalized. So if you get an opportunity, as soon as you can, please go and vaccinate.